Assalamu alaikum, dear students. I hope all are you okay by the grace of Almighty Allah. Dear students, today's topic will be instruments for obstetrics and gynae. Instrument usually come in your exam in OSP exam, and also related question may ask at any time during Viva and during SAQ, anytime related question may come. So today's topic is instrument for obstetrics and gynae. I am Dr.Irin Parveen, Associate Professor, Obs Gynae, Salimullah Medical College. So let's start. Can you see? Can you see the slide?
ম্যাম জি ম্যাম দেখা যাচ্ছে ম্যাম আপনি পরের স্লাইডে যেতে পারেন
Okay.
জি ম্যাম দেখা যাচ্ছে
At first we'll start with some instrument for DNC. You know, DNC means dilatation and curettage. We start with some of this instrument. At first, this instrument, this is a Valsalem forceps. This is a Valsalem forceps. Here, there is a catch at this end, and at this end, there are 2 to 3 tooth. With this tooth, cervix can be held, and it can be catched. What is the use of this instrument? In gynae, it is used during DNC, during evacuation and curettage. During DNC and evacuation and curettage, we hold the anterior lip of the cervix with this instrument. And during vaginal hysterectomy and further Gill's operation, with this instrument, we also hold the anterior lip of the cervix. And we also hold the posterior lip of the cervix during colpotomy. And these are the gynae use. And what are the use? Obstetric. In obstetric, we use this instrument is use of this instrument is limited because this can cause injury to the cervix. We may hold anterior lip of the cervix with this, and instead of this instrument, a sponge holding forceps is sometimes used in pregnant uterus. Next, this is the ovum holding forceps. Look, this is like ovum, like ovum, and there is no catch here. This instrument is used during DNC evacuation for evacuation of the product of conception. And this is the instrument. This is sponge holding forceps. What is the use of this instrument? This is sponge holding forceps. There is a catch, and there is a perforated end. This is sponge holding forceps, and we hold swab, that is gauze. Swab holding forceps is used to paint the abdomen or vagina for giving wash. Gauze are held with this end. We also use this instrument for evacuation. If there is large amount of product of conception retained in incomplete abortion, this can also be removed with this. And in OBS, we use this instrument during cesarean section to hold the corners of the uterus, And also we can use this instrument to hold the anterior lip of the cervix, as we had already mentioned. And in gynae, we use this instrument for evacuation of uterus in case of incomplete abortion. So next, this is instrument. This is called curate. There's two end. One end is sharp and other is in blunt. Curate is of different shape. This is blunt end and this is sharp end. Sharp end is usually used for curettes. Curettes may be of different size and maybe this end may be small, narrow, maybe wide, more bigger than this, more larger than this. This instrument used to curate the endometrium. It can be done during DNC operation to curate the endometrium during molar pregnancy, and if there is any retained product of conception, curettes may be done. Also, diagnostic curettes can be done in case of AUB. AUB means abnormal uterine bleeding. Diagnostic curate is done if we think about if there is endometrial hyperplasia or tuberculosis or any endometrial carcinoma, we curate the endometrium with this curate. Next, this is kidney tray. This is kidney tray. It is called kidney tray because it is kidney shaped. And what is the use of this instrument? In case of DNC, we can put the product of conception here. And in other case, such as during cesarean section, we put the sharp instrument here, such as scalpel or scissors here. And after cesarean section, we can put the placenta here. And during hysterectomy, abdominal hysterectomy, or any ovarian tumor operation, we can keep the operated material here. So this is the kidney tray. This is a galley pot. This is a galley pot, and the black material is the Povicep, povidone iodine. It is used to give the
this is the galley pot containing Povicep solution, which is used to wash.
Wash is given with these gauze. These gauze are there are different types of these gauze can be soaked with povidone iodine and wash is given. This is speculum. This instrument is called Sims double-bladed bivalve posterior vaginal speculum. Sims double-bladed posterior vaginal speculum. This end and this end. This end is slightly smaller than this end, so that it can be used in different. If patient is young, this end is used, and if vagina is more spacious, this end can be used. What is used? It is used in gynae for diagnostic DNC, for DNC due to any cause of incomplete or missed abortion or evacuation of curettes, and it is also used during vaginal hysterectomy, any type of vaginal operation. This instrument can be used. It retracts the posterior vagina. And during vaginal hysterectomy, during Fothergill operation, and during cystocele repair, this instrument is used. It is also used to collect any materials for swab, high vaginal swab, or endocervical swab. This instrument is used during swab collection. It needs assistant. It needs one assistant to hold this. And in obstetrics, this is used to detect prom. And if we use this instrument, then we have to retract the anterovaginal wall with other instrument. And in case of during PPH, we can expose the vagina with this instrument, and these are the use. And if there is any retained product of conception, it can be used in case of also gynae. So this is the SIMS double-bladed posterior vaginal speculum. This is this instrument is called Caucus bivalve self-retaining vaginal speculum. Caucus bivalve. There's two valves, anterior and posterior. Bivalve self-retaining, because there is a screw here. Screw. So it can be held by this screw, and no assistant is required. Caucus bivalve self-retaining speculum. It is used in obstetrics to detect prom, and also used in gynae in different operations, such as introduction of copper T and removal of the copper T for via, that is visual inspection of the cervix. We can see the cervix with this instrument. Any lesion in the cervix, we can see with this instrument. If we want to take cervical biopsy, this instrument can be used. We expose the cervix with this instrument. And swab may be collected, high vaginal swab or endocervical swab may be collected with this instrument. So this is the Caucus. This is also called sometimes duck speculum. It is like duck's beak. And there is a screw, it can be tightened or can be released. If it is tightened, then it will retain self. So it is called self-retaining bivalve speculum. These are the dilators. These are the dilators. These are called gradual dilators because this is the thin and these are more wide and more wide than this. There may be different types of dilator according to diameter. This is called Hager's dilator. Hager's dilator. It has two ends. Both ends can be used. This end is thinner than this one. This end. These are used to dilate the cervical os. When cervical os dilatation needed? During DNC. That means dilatation in curetes. The operation indicates the dilatation. That means it has to be dilated by this instrument. Dilatation. And we can also use this instrument for operations such as Fothergill operation to dilate the cervix, and during to give bite in the Fothergill cervix, in the cervix. And there are some hazards, such as if we use the sharp dilator, uterus may be perforated. Uterus may be perforated. And if we use the more dilated instrument, in case of diagnostic DNC or in case of dilatation and curetes, then cervical incompetence can occur. Cervical incompetence. And with this thin end, also cervical laceration may occur. So there are the different type of dilator. What is this? This is a metallic catheter. This is female metallic catheter. This end, there is perforated end with this urine come into it, and this there is a guard. There is a guard. This is used to evacuate the bladder. To evacuate the bladder before some operations, such as before DNC, that is dilatation and curettage, before vaginal hysterectomy, Fothergill's operation, etc. That is a female metallic catheter. Female metallic catheter. There are also other types of catheter. This is called plain rubber catheter. Plain rubber catheter. Here, this end is perforated and urine may come. There are different types of use in our practice. We can evacuate the bladder with this plain rubber catheter before some operation, such as DNC, cesarean section. If we do not want to keep self-retaining catheters, such as Foley's catheter, we can evacuate the bladder with this rubber catheter, plain rubber catheter, before operation. In cesarean section, we always do not perform catheterization. That means self-retaining catheter we do not always use. If in case of elective cesarean section, we usually evacuate the patient. We ask the patient to evacuate the bladder herself by going to washroom. And in some case, we have to evacuate with this catheter. There are some other use. It can be used as a tourniquet. Sometimes it can be used during myomectomy operation. It is passed through the broad ligament and to ligate to partially obliterate the uterine artery. And it is also used in obstetrics during condom catheterization in case of postpartum hemorrhage. So it is the plain rubber catheter. This is uterine sound. This is uterine sound. Here, there is an olive-like end. This is blunt. And uterine sound, it acts as a first dilator. It is the uterine sound. It acts as a first dilator. Look that there is a curvature. There is a curvature. It can detect the direction of the uterus, whether anteverted or retroverted. But what are the hazards? Uterus can be perforated with this instrument if used forcefully. And there is mark, and we can measure the length of the uterus by this instrument also. This is the swab soaked with Povicep. This is the this is a syringe called MR syringe. MR syringe. MR syringe. This is called.
And this is the plant.
This MR syringe. There is a valve. There is one valve. There is the one valve, and this syringe is about 50 cc. And 50 cc, there is a plunger, and negative pressure can be created by pulling it. And it is used during MR, that is menstrual regulation. During menstrual regulation, a canola is attached here, and it is introduced into the cervix, and content is evacuated by creating negative pressure within it. These are the canola. So this is used during menstrual regulation. So this is the MR canola with MR canola. These are the MR canola This is green, and this is the MR syringe. There is another syringe. This is here, the valve is on both sides. This is called MVA canola. MVA canola, that is manual vacuum aspiration canola. Manual vacuum aspiration can be done during, in case of incomplete abortion, or in case of missed abortion, or if there is blatant ovum, manual vacuum aspiration can be done. There is a syringe, and this is rubber end, and there is a plunger, and negative pressure can be created by pulling this, and at this end cannula is attached, which is introduced into the cervix, and by creating negative pressure within it, contents of the uterus can be sucked out. This is the kidney tray. These are the towel clip, and this is the galley pot. Up to this, these are the instrument for diagnostic, for DNC, diagnostic DNC, and for in diagnostic DNC and curettage. Up to this. So during DNC, these instruments are required. And now we will show the instrument. What are the instruments used during cesarean section? These are the towel clip, and this is the galley pot, and this is the Euro bag, and this is the Euro bag. And this is the Foley's catheter. Foley's catheter. This is a self-retaining catheter. Here there is two ends. One end, urine can come, and other end there is a balloon which can be dilated, and it is self-retained. Dilated with normal saline or distilled water. About 5 to 6 cc water is passed through this balloon, and it is dilated and retained within the bladder, urinary bladder. This is called self-retaining Foley's catheter. There are different size, such as 14, 16, and as the size decreases, it becomes narrow. Diameter of the Foley's catheter becomes narrow. What is the use of this? To evacuate the bladder, and if we think that bladder should be emptied for a period of time, this catheter can be used. We can use during cesarean section if we think that we perform the catheter to evacuate the bladder, continuous evacuation of the bladder. So in case of cesarean section, we can use this, and we can do cesarean section without using this. And in case of abdominal hysterectomy, we usually keep this catheter for 24 hours. In case of vaginal hysterectomy, this catheter can be kept for 24 hours to 5 days. Some of the examiner wants to keep this catheter for 3 to 5 days. This is actually according to surgeon's choice. In case of Parveen's hysterectomy, that is the operation for carcinoma cervix, and this is kept for 5 to 10 days according to surgeon's choice. It is also used to during VVF operation, after VVF operation, that is vesicovaginal fistula operation. It is kept, and in that case for prolonged period of time, that is for 21 days. Some surgeons use for 2 weeks to 3 weeks. So this is Foley's catheter. These are the instruments. Here there is a BP. This is BP blade. BP means Parker blade, Bird Parker blade. It may be of different size according to that, and there are different types of blade can be used. This is called Bird Parker handle. BP handle. And there are different types of BP blade according to that. According to size, it can be used in that size of the Bipart handle, BP handle. And these are the forceps. This is called toothed forceps, and it is plain forceps, no tooth. These are used to hold the tough structures. We can hold the peritoneum or rectus or margin of the uterus during operation with this instrument. These are the instruments for cesarean section. This is a needle holder. There are different types of needle holder. This is long and this is short. Short needle holder is used during when we use small needle, and such as 2030, and this for large needle. These are the artery forceps. Artery forceps. And these are the tissue forceps. These are the artery forceps. Three types of artery forceps. This is long, this is median, and this is short or mosquito forceps. This is also called mosquito forceps. Artery forceps are also called hemostatic forceps. It can be straight like this or maybe curved. What are the uses? It can be used during cesarean section to hold the peritoneum. It can be sometimes it can be used to it acts as a hemostatic forceps to hold the blood vessels to control bleeding, and these are also used to hold some of the stay sutures. And this is the long artery forceps. This is used in abdominal hysterectomy. By it, we can also put drain in the abdominal cavity. By this, we can perforate the abdominal wall. This is a cesarean section. Actually, this is a trolley of the cesarean section. This is the sucker tube. And this is the diathermic cord. Diathermic cord. There's two buttons. One is blue for coagulation and one is yellow for cutting. If we push this, then tissue will be cut. It is attached with the electricity and tissue will be cut. And we push this, the tissue will be coagulated. If there is a bleeding, small bleeding vessels, we coagulate with this. We coagulate by pushing this instrument button, and the bleeding vessel will obliterate by coagulation. This is a cesarean section trolley. This is a cesarean section trolley. So this is the kidney tray, this is the gallipot, and these are the sponge holding forceps. These are the scissors. These are the tooth forceps, and these are the needle holder. These are the artery forceps. These are the Ellis tissue forceps. Ellis tissue forceps. And these are the mop, and this is the Doyens abdominal retractor. Doyens abdominal retractor is used to hold the urinary to retract the urinary bladder. And these are the draping sheets. This is the Doyens abdominal retractor. It retracts the urinary bladder. It is used during cesarean section. During cesarean section, this retractor is used. And this is the forceps. This is the forceps. Forceps is used during, forceps is given in cesarean section trolley because sometimes we use this instrument during cesarean section. If the head is floating, it helps, it acts as vectis and helps to elevate the fetal head. These are the sponge holding forceps. 5 sponge holding forceps is given during cesarean section, one for giving wash and other to hold the corner of the uterus. These are the mop, these are the draping sheets, these are the towel clip. Towel clips are used during draping. This end helps to attach the draping sheet with one another. There are other use also. During myomectomy operation, we can hold myoma by this towel clip. These are the instruments for holding and cutting the umbilical cord of the fetus during cesarean section. This is the straight artery forceps. Usually, Caucus artery forceps are used during umbilical cord clamp. Caucus forceps. 2 Caucus forceps are used for clamping the umbilical cord. And this is the cutting scissor. This is BP handle with blade. This is blade, and this is the tooth forceps. This BP handle should be kept in a kidney tray, because if we keep it in the patient over the patient's abdomen in the draping sheet, injury can occur at any time. Accident can occur anytime. So it should be kept in a kidney tray. So this after this trolley preparation, this is the kidney tray, these are the forceps, these are the towel clips, these are the cutting set, other instrument of the cutting set. This is 2 tissue forceps, 2 artery forceps, and one forceps. And these are the tissue, and these are the artery, long artery. And this is the forceps. These are the different sizes of MBA cannula. This is the MBA syringe. It is 60 ml, capacity is 60 ml. It has 2 valves. And these are the different sizes of the cannula. This is 4, 6, and according to size, this diameter will increase. And there is different types of color for easy recognition. What is this? This is a chromic catgut. This is a suture material. What are the suture materials used in Obs and Gynae? Suture material are used in Obs and Gynae are vicryl, catgut, silk occasionally, and also we use proline, and we can also use PDS suture. Chromic catgut are rarely used nowadays, but it can be used during cesarean section. There may be different types of chromic catgut. Chromic means there is a material which makes the thread more it can be used for prolonged time, such as 1 month to 2 weeks to 1 month. And the end of this is there may be round-ended. The size may be different size, such as 0, 1, 2, 10, 20, that are more narrow. 10, 20 are more narrow needle, more small needle. And this is the vicryl. This is blue color, and the suture material is more less tissue reaction, and the tensile strength is persist for about 3 months. So these are the more it can be used during cesarean section to suture the uterus, and during hysterectomy for clamping and ligating the clamps. And these are the sutures nowadays more commonly used, and there may be different size, 2, 1, 2, 3, 30, 20, 0. This may be cutting. That means the needle may be sharp, reverse cutting, or maybe round. Tip of the needle is round. There are other types of suture which are used in obs and gynae, such as silk. Silk can be used to give a ligature in a drain, or skin may be closed by a silk. And there may be other sutures such as proline. Proline are non-absorbable sutures. Suture materials are absorbable and non-absorbable. Catgut and vicryl, these are the absorbable sutures. And silk, proline, these are the non-absorbable sutures. These are not absorbed in the body. And PDS is also absorbable, and it can retain for more than 3 months. This is umbilical clamp, used to clamp the umbilical cord of the neonate. These are the forceps. During cesarean section, this is used. It acts as a vectis and helps to elevate the fetal head in case of floating head. And what are the use of forceps? We know that if there is fetal distress in second stage, or if there is maternal distress, or there is rigid perineum, fetal station is 3+, but there is rigid perineum, forceps can be used. It can also be used in case of heart disease or in case of eclampsia, where we do not want to prolong the second stage of the labor. So these are the indications. What are the prerequisites for forceps use? There are some prerequisites such as head must be engaged and fully rotated, and cervix must be fully dilated, and bladder should be evacuated, and uterine contraction should be present. These are the prerequisites for forceps delivery. What may be the what are the disadvantages? With this instrument, if properly not used, and there may be trauma in the vagina, laceration and trauma in the vagina or cervix, or there may be fetal trauma, fetal scalp laceration, and even cephal hematoma may occur with this instrument. Only nowadays, only outlet forceps are used, or ring leaf forceps. What is this? This is the venous cup. Venous cup. There are different types of cup. This is silicone cup, and this is metallic cup. Venous indications of venous are like in that of the forceps, and it needs more time to deliver the fetus than forceps. And we should not use in case of premature fetus. We should not use venous in case of premature fetus. What are the advantages? It does not cause any maternal injury usually, but fetal scalp injury may occur with this instrument. A chignon may form, and there may be scalp hematoma or some bruise with this instrument. This is Caucus Forceps, which are used in case of obstetrics. It is used to hold the umbilical cord, to clamp the umbilical cord after delivery. And it is also used to rupture of the membrane, artificial rupture of membrane for induction of the labor. Artificial rupture of membrane for induction of labor. And it is also used in case of gynae to hold the tough structures. Sometimes it can be used as a clamp, and it is also used to hold the tough structures, such as rectus sheath or some vessels, a clamp. It acts as a clamp during hysterectomy. This is the Morris retractor. It can be used to retract the urinary bladder in case of abdominal hysterectomy. This is the Doyens. This is the right angle retractor. This is the diverse retractor. Diverse retractor. There may be different types of diverse retractors. Some are the more slender and thin, and some are the more wide. It can, in gynae it can be used during hysterectomy operation to retract the posterior structures such as intestine, and sometimes can be used to retract the bladder anteriorly. Diverse retractor. It is initially used for retracting liver in case of cholecystectomy. So it was also called diverse liver retractor. Diverse liver retractor. This is Landen retractor. It is used during vaginal hysterectomy. Can you see this slide? This is a penguin sucker. Penguin sucker. It is used to suck the mouth or nose of the newborn if there is any secretion. These are the cannula. Cannula are used to give IV channel. There are different types of cannula such as green and pink. This is 18G. 18G. So this diameter is more wide and black can be transfused with this. And the blue and the yellow, these are the narrow, and it is used in pediatrics department. And yellow and green and pink are used in gynae department. If you use narrow cannula in case of gynae ops, if we transfuse blood, blood cell maybe there may be rupture of the blood cells and during passage of this cannula, and so there may be hemolysis. This is an instrument we usually use during colposcopy. This is a punch biopsy forceps. Punch biopsy forceps. It is usually used in outdoor to take biopsy from cervix. To take biopsy from cervix. From where we take biopsy? After via examination, if via is positive, and after colposcopy guidance, during colposcopic examination, if via is positive, from that side, biopsy is taken. And it is sent for histopathology to diagnose and if there is carcinoma present or not. So up to this, these are the instruments usually used in obstetrics and gynae. I think this will help you. This class will help you. There may be other instruments which are not included in this lecture. You have to go through your book again and again, and you have to read yourself. We try to show you some of the instruments because you are not going to work in this period of time. So thank you very much. Thank you very much.